I'm Dr. Snehal M Kulkarni, Senior Pediatric Cardiologist and Director Pediatric Cardiac Sciences, Fortis Hospitals, Mumbai. When we are dealing with pediatric cardiac patients, many times we have been asked this question: is the heart of the child dilated? Is the function normal? And is it really a normal child? So, what is this dilated heart? So sometimes we do get this kind of a patients having holes in the heart or artery getting narrowed. That is one part of a heart problem, the spectrum of the heart problem where the hearts are dilated. But the another most important part is that the heart muscles are becoming very weak, and as a result of that, the heart gets dilated. Heart pumping function is not normal, and that is the thing which is really of worry. This is called as either cardiomyopathy or dilated heart, and it's very important to see what we can do for this kind of a children and how do they present. So how do we detect that the child's heart is enlarged? Many times what happens, the children become breathless. They may not be able to play in the school like other children. They can't climb the staircases. Sometimes they get abnormal heartbeat, what is called as a palpitation. They have giddiness-like symptoms. Sometimes they may even have swelling over the face and over the feet. That is one of the way we can think that the child's heart might have become big, or the child's main important is whether the pumping function of the heart is normal, and that is a very important thing to be looking at, because these kind of a children, not only they have a dilated or enlarged heart, but the pumping function of the heart is also significantly decreased. So how do we diagnose that? We usually do echocardiography, where we can see the child heart is dilated, child heart function is not normal, and many times there are some leaking walls in addition to the dilated heart which is not functioning normally. We rule out any correctable cause, like sometimes are there holes in the heart, or sometimes the arteries are narrow, or if there is any deficiency, something like vitamin D or calcium or some other metabolites. And when we rule out those kind of a so-called correctable causes, we label this condition as dilated cardiomyopathy and start treating them. Initially, we do start medical management to stabilize the children, to improve their symptom and the functional class. But most of the time, beyond a certain limit, the heart function may not improve correctly or the way we want it to improve, and these kind of patients may need to undergo a treatment called as a heart transplantation. Because if the heart function doesn't improve with medication, these children will become symptomatic and they always will have a risk of what is called as a sudden cardiac death. And therefore they need to be consulted to a transplant cardiologist, get all the investigations done, and they need to be listed for heart transplantation. And once they get a proper donor, which is an age match and weight match, blood group match, they are usually asked or advised to undergo heart transplantation. Definitely after heart transplantation, they need lifelong surveillance, they need certain medications, they need to undergo biopsy of the transplanted heart, but most of them, they have good lives with no symptoms. Definitely they will be on continuous medical management and